So this patient's coming in for evaluation of an expanding lesion that's happened over the course of the last couple of weeks. So I'm working with Dr. Jane again. So what's happening here if you look at these?
So these are punctum and
Yeah.
some drainage is happening.
So there's pressure coming up, right? So this is the body's trying to heal itself as best it can. And what is this most likely?
An infected cyst.
Yeah, and the reason why we look at more of a cyst as opposed to an abscess, it's got a defined border and it's not quite as superficial spread as I would expect. Now you can sometimes be fooled, but we'll know for sure when we actually open it up. And what would we expect the difference to be? If it was a pure abscess, what would it look like versus a cyst?
So pure abscess, you'd get more pus-like and liquidy
Yeah.
material coming out, whereas a cyst would be more
Keratin, right? So you get a thicker, exactly. So you're gonna get a thicker amount with this. So we're gonna start to freeze this up. What's the limitations with the freezing in this case?
If it's infected, the freezing won't be as effective.
Yeah, it won't heal as well, right? So, and these puncta here, it's gonna sort of want to spray out of that area. And the other thing we wanna try and avoid if we can. So we always wanna be very superficial because if you push it into the lesion, it'll create pressure, it'll be more uncomfortable for him. So we wanna be as superficial as possible. So I'm gonna put some freezing into this. Just bear with me. We've already added some topical anesthetic in this, and antiseptic, I should say. So this is where you just want to reach into it just a little bit, and I want that to blanch ideally. So just like it's doing now. So I'm doing that slowly. You okay?
Yeah.
Maybe a little bit more over here. So essentially, you can see how that's draining a little bit already. So I just want the bevel of the actual needle to go in, and that's about it. And then I want it to spread just like that. Not too much pressure there.
No.
Yeah, and that's because we're not into the actual capsule itself, so that's why we're able to do that. Just add a little bit more. So, and why does the infection interfere with how lidocaine works?
Because of the acidity of the so it needs to be kind of activated. It's like
Yeah,
alkaline
it
salt.
essentially maintains in its ionized form. And so when lidocaine's ionized, it actually can't penetrate into the actual cell membrane, so it can't exert a safe activity. Does that hurt there?
No.
Not too bad. So for this one, we use a number 11 blade, because we want to be puncturing this as opposed to doing an incision. You okay?
Yep.
So just gonna put some pressure on this. You see there it's blocking? See that's where you see the cyst. That's the particular matter I was talking about.
And then if it was more of an abscess, it would be just liquid.
Yeah, just see pure liquid. So essentially what I try and do here is I'm going to be just opening up in different areas. See if I can get that. That's not too uncomfortable?
No.
You're okay? Good. So the assessment here is going to be, is this incision big enough to allow us to get as much particulate matter out as possible? If we think it is, we leave it. If not, I extend it just a little bit. There's always a balance here because, again, typically we don't have good anesthesia. That's not too uncomfortable?
No.
So I'm just going to extend this just a little bit. And should we treat this with an antibiotic afterwards?
Because it's an infected cyst, it might be a good idea too. So, but he's already on as well.
Yeah, so it sort of takes that argument out, so we probably maintain that. Again, there's studies that'll show it does make a difference in terms of, sorry, I know that's hurting a little bit. In terms of recurrence rates and those type of things, but we try and avoid that if we can, just because we're trying to limit bacterial resistance. Remember we talked about before, if I use it as an example, strep pneumonia, and its resistance to macrolides. Remember, about 20 years ago, the resistance rates were about 2%. What is it about now? What's it floating around?
15-20%.
It's up around 30%. So this is why, and there's similar examples we can use throughout. So once I think we've done pretty well with this, I'm just going to be irrigating this because we want to clean that as much as possible. So we'll do a couple more. So with irrigation, I'm just changing the angle of it as best we can. So beyond clearing this out, it also helps dislodge sometimes other fragments that are there. And should we pack this? That becomes the big argument too.
Packing, is it kind of something with an extra antibiotic in it, like a local?
No, you can have packing that's infused with some stuff, but generally, so when I was taught eons ago, we used to pack everything, and we'd pack it for a long time. You pack it every single day. So, but now studies will show that it actually doesn't promote healing. It's just sort of more difficult for the patient. So it becomes two specific cases where I'll pack. One is where we want to achieve hemostasis, so it's just bleeding. Or if I think it might be collapsing into itself with respect to loculations. I don't feel that specifically in through here. Does that hurt at all?
A little bit.
Yeah. So this is where I'm careful. So as opposed to being aggressive and trying to break down loculations, I will put some packing into this just for one night. So just that we're going to allow this to sort of actually see if it'll collapse into itself, because it's an infected field or inflamed field at the very least. And we don't want to be causing him undue discomfort. So we'll just pack this only for the evening while he has anesthesia in it, and then we'll see him back tomorrow and hopefully take that out. If anything's collapsed into it, then we'll be okay with that.
So it helps the loculations kind of break apart?
Yeah, it gives them a chance to sort of break open. So I'm just going to take a swab here to send this off. So swabs, again, I do at the end of the procedure because we want it to be as clean as possible so we can get some live bacteria. So if I had sent that initial stuff that came out, remember pus is just dead cells.
I had a polynidal.
Polynosis? Yeah.
Way back in the day when I was young.
Yeah, that's just a different variant.
It was down in my career, and they sliced and packed and then cyst bags for like 4 months.
Forever. Yeah, and that's something that we've gotten away from a little bit.
I see.
Now they might still do it for a couple of days, and depending on the clinician, you see some still do it long term, but it's just not what we thought it was. And it's, like I said, it's, as you're aware, it's uncomfortable.
No, that was, and then if it healed too quick, he would split it back open again.
Yeah.
Sutures or something way back in the day.
Yeah, that approach would be a little bit different now. So this we just want to put in a healthy amount, not too much. You okay there? Yeah, see if you feel that. Yeah, I'll stop in a second. Just dab that. And this is why you're seeing now he's giving out some anesthesia and it's uncomfortable. So this is why we shouldn't continue this long term. So this is literally going to be one evening, and then we'll take this out. Now the other thing we have to learn about is how do we cut this string. So we want to maintain sterility through the actual ribbon gauze. So what you do when you're doing this, you cut your first cut up here, Jala. Cut there. Very good. And so now this piece, you'll actually grab and then cut there. So now your scissors, if they're contaminated, you don't have to worry about it, right? All right, and then we'll just put a dressing on that, and then we'll see him back tomorrow.
अच्छा, आज हम आप लोगों को बताएंगे कि ये हमारे पास कीज़ जो हैं, ये हमारी कीज़ हैं जी, जिसको हम ओपन करते हैं डोर के लिए, इसे हमें ओपन करते हैं, और ये बहुत ही कमाल की कीज़ हैं जी। ये डोर के लिए बहुत ही मुफीद है, और इससे हम डोर ओपन करते हैं अपना, और फिर हम घर में एंटर होते हैं। ये बहुत ही कमाल की चीज़ है, और कमाल की ये की है जी, ये बहुत ही कमाल की है। इससे हम बहुत कुछ ओपन कर लेते हैं जी, और इससे हम घर अपना ओपन कर लेते हैं, इससे हम अपने बहुत चीज़ें ओपन करते हैं जी, ठीक है। और आप लोगों ने भी अगर इसको लेना हो, बाय करना हो, तो आप इसे ले सकते हैं जी, ठीक है। और ये जो की है ना, ये बहुत ही कमाल की है। इसका जो लोगो लगा हुआ है ना इसके ऊपर, वो मैं आपको दिखाता हूँ। ये देखो, ये लोगो लगा हुआ है इसके अंदर, ये देखो, ये लोगो है जी इसका। आप लोगों को क्लियर मेरे ख्याल से नज़र आ रहा है, नहीं नज़र आ रहा, बट ये बहुत ही कमाल का लोगो है, और ये की भी बहुत ही कमाल की है। तो इसको इस तरह की कीज़ बनवाएं आप भी। थैंक यू।